Hello, everyone. Good afternoon. Welcome again to another episode of Doctors Go Live on Columbia Asia Facebook page. Today, we have with us a pediatric cardiologist and also, of course, a consultant pediatrician of Columbia Asia Hospital Setapak, Dr. Jasvinder Kaur, who will be talking to us about congenital heart diseases in children. Okay, so it's not just something that happens, excuse me, among adults, but it's also something that happens in infants and children in general. So, how are you, Dr. Jasvinder?
I'm fine, thank you. Thank you
That's
so
good to
much for
know.
inviting me to the show.
No problem at all. It's our pleasure. Okay, now we're just going to go straight into the topic. Again, it's congenital heart diseases in children. So we will
Yes,
just be referring to it as CHD
correct.
for convenience sake. Okay, all right. First of all, maybe doctor, you would like to tell our audience what exactly is CHD hereditary? First of all.
Yes, CHD is hereditary in 10 to 12% of patients. CHD or congenital heart diseases means a heart defect which is present since the baby is born. And it can be
Hmm.
detected in utero, that means when the mother is pregnant.
I
So it
see.
is
I
not
see.
something that happens after the baby is born. It is something that happens while the baby is being formed and while the heart of the baby is being formed, usually within the first 2 months of life.
I see. I see. What are the causes of CHD?
Okay, like I said, it can be hereditary in 10 to 12% of patients. The other
Mhm.
causes can be diseases in the mother, for example, systemic lupus erythematosus, or if the mother
Okay.
has infections such as rubella,
Mhm.
all right, if the mother has diabetes, or other
Mhm.
infections such as cytomegalovirus, toxoplasmosis. So
Mhm.
that increases the risk of the child developing congenital heart disease. It is also
Mhm.
advisable for the mom not to take alcohol or smoke during pregnancy, as that increases the risk of congenital heart disease in the fetus and the newborn.
I see. Well, that's quite a number of conditions actually that can contribute to CHD.
And
Perhaps we can narrow it down and tell us what are the common types of CHD in children.
well, congenital heart disease is divided into acyanotic, meaning that the baby's born will be pink, or cyanotic, meaning that we will have a blue baby when the baby is born. So the common
Mhm.
acyanotic heart diseases, or the diseases in which the babies are pink, are ventricular septal defect. That means a hole in the lower part of the septum of the heart. Atrial septal
Mhm.
defect, meaning there is a hole in the upper part of the septum of the heart. Pulmonary
Mhm.
stenosis, meaning that there is a narrowing in the blood vessel going to the lungs. Aortic stenosis, meaning that there is a narrowing of the blood vessel going to the whole body. Or there can be PDA, which is known as persistent ductus arteriosus, which is
Mhm.
persistency of a bridge connecting the blood vessel going to the lungs and to the whole body. So these are the common acyanotic or the pink baby heart defects. The blue baby heart defects are tetralogy of Fallot and transposition of the great arteries. Sounds like a
Mhm.
big term. Now, what is tetralogy
Yeah.
of Fallot? Tetralogy of
Yeah.
Fallot means that it is a defect in the lower part of the septum. The right side of the heart is thickened. The blood vessel
Mhm.
going to the lungs is also thickened before the valve. All right, and there is a hole in the lower part of the septum. What is transposition of the great arteries? Transposition of the great arteries means that the both blood vessels are arising from the different chambers of the heart. For example, the
Mhm.
blood vessel from the lung. It is supposed to
Mhm.
arise from the right side of the heart, now is arising from the left side of the heart. And the
I
blood
see.
vessel that is going to the whole body, which is the aorta, which is supposed to
Mhm.
arise from the left side of the heart, is now arising from the right side of the heart. So these are the
Mhm.
common blue baby heart defects, which we see in the newborns.
I see, I see. Well, I've heard of the term hole in the heart. I think that's quite a common term that we say, and didn't realize it's actually literal. That when you say hole in the heart, actually there is a hole in the heart. So,
Yes.
which condition is this? Because that seems to be the more common ones. Because I
Yes.
remember when I was in school, there would be quite a few of the girls would have a hole in the heart, so they can't participate so much in sports. Parents would get worried all the time. So, it seems like this is a very common occurrence among Malaysian children. Would that be right?
Well, it's not a very common occurrence in Malaysian children, but
Mm,
certain heart defects are more common. The
mm,
incidence of congenital heart disease is 4 in
mm,
1,000 live births, and this is an
mm.
international um, percentage. It's not a Malaysian percentage. We don't have the Malaysian percentages at this
Okay.
point in time. And the
Mm,
common holes in the heart are, like I said, ventricular septal defect, meaning that there is a hole in the lower part of the septum of the heart or atrial septal defect, meaning that there is a hole in the upper part of the septum of the heart. So these are the commonest. There are many other holes in the heart, and these holes may occur in isolation or they may occur in combination with other heart defects, which makes it more complex.
Okay. The hole in the heart that you mentioned, usually is it just one hole or a few holes that can happen?
It can be a single hole or there can be multiple holes.
Oh, I see. And these can develop even when the baby is not yet been born, as early
Yes,
as 2 months.
yes, because the heart develops in the first 2 months of pregnancy. So that's when the most parts of the body are developing. So if there is a heart defect, it is going to present within the first 2 months of the pregnancy. Of course, it cannot be detected then. We can only pick this up usually when the mother is around 14 weeks pregnant and above.
I see.
And
At that
usually,
age, when the baby, when the fetus is at that age, is that
yes.
something that we can do to help the problem?
No, we cannot do anything at that point of time because we cannot detect these heart problems as early as 8 weeks of pregnancy. It only can be detected 14 weeks and above. And when we can either see whether it can be treated or whether it will cause a problem to the fetus, it will cause a problem to the mother, or it needs an operation or intervention once the baby is born. So by making the diagnosis at that point of time, it's going to help the parents to prepare for the delivery of the baby with a heart problem. Because the plan is very important, because we have to see whether the baby can be delivered in a normal hospital, a private hospital, or the baby has to go to a tertiary center or center with pediatric cardiology specialty. So all these can be planned for the baby so that when the baby with a heart defect is born, the baby will be in good hands and to minimize the morbidity and mortality of this baby.
Right, yeah. So when something like this happens, it's not just about the baby. There's a lot about the parents as well, because you have to be ready.
Yes, of course.
When you say you need to prepare the parents, does that mean physically as well? I mean, mentally as well.
We need to prepare the parents mentally because we need to plan for the delivery of the baby, and we need to let the parents know that if the baby requires surgery in the early term after delivery of the baby, where are the places where surgery can be done, the cost involved, and the site of the operation. So that is very important for the parents, because we do not want the parents to get surprised when the baby is born or go into denial. So all this is preparation of the parents, because we know that many congenital heart diseases have a good prognosis or good outcome. So if we can do in a planned manner, the outcome for the baby and the parents will be fantastic.
I see. Okay. All right. So the earlier the better lah.
Earlier the better.
Stage. Yeah. No, sorry. I think we've already addressed this question about at which stage of conception do heart problems occur in the womb. So that's at 2 months. But you can only detect when the mother is at 40 weeks of pregnancy. Okay. Can heart problems develop after the child is born? For example, in the heart?
No, the congenital heart diseases usually develop while the mother is pregnant, during the fetal stage itself. It doesn't develop later. That's why it's known as congenital, something that the child is born with.
Okay. All right, I see. And what are the symptoms that a child has a heart health, quite a tongue twister there, that a child has a heart health problem? But I think we addressed this already as well, because you were mentioning at 14 weeks, doctors would monitor the baby, and then at 14 weeks you can already tell that the baby has a heart problem.
So the symptom of which the baby is having a heart problem can start as early as the fetal stage. So during pregnancy, we can see the structure of the baby's heart by scan, and then we can see the site of the hole and whether the baby's heart is becoming bigger and it's causing problem to the pregnancy or not. If that is causing a problem, there is certain action that we need to take. If it's not causing a problem, what happens when the baby is born? The symptoms that can develop will be the baby could be blue, in a blue heart defect, or the baby could have poor feeding, difficulty feeding, poor weight gain. Okay, but
what about the mother? Yeah. Sorry, I interrupted you. Do you have more to add to that?
Usually the heart defects do not cause a problem to the mother. It only causes a problem to the baby. Yes.
Yeah. So there are no symptoms as far as the mother is concerned. Like everything will
usually
be on
not. Usually not.
Okay, all right. And then what are the procedures that a child has to undergo in order for doctors to check a child's health? But again, this is about when the baby is already born. You were
Yes.
saying that there could be surgery, and are there any other ways to improve the condition of the baby's health apart from surgery?
Yes, of course. There is we can do in well. The first that we usually do is we start on medications. Okay,
Mm-hmm.
depending upon the heart defect. So if it's a pink heart defect or blue heart defect in which the heart size is a bit big and there's excessive blood flow to the lungs, then we can start the baby on anti-failure medications. All right. So this
Immediately at birth?
yes, soon after birth we can start. Maybe usually by day 3 to day 5.
Oh, I see.
Right, and
Okay.
then if that doesn't work and the baby requires further medications, sometimes these blue heart defects require patency of a bridge, which I was mentioning, between the blood vessel which is going to the lungs and the left side of the heart, okay, for the
Mhm.
baby to get enough of blood supply to the lungs. So then we
Yeah.
need to start a medication known as prostaglandin to ensure that the baby is getting enough of blood supply to the lungs and to the entire body. So this is all just awaiting either surgery or awaiting non-surgical method, which is known as interventional cardiology. In interventional cardiology, what we can do is we can
Mm.
close the holes, some holes which are suitable in the heart
Mm.
using devices, or even
Mm.
blow up the valves which are small, narrowed, okay,
Mm.
or even maintain the patency of blood vessels which are
Yeah.
required for blood flow to the lungs by
You,
applying stents.
I
By
see, I see. What
inserting
sort of devices that could be, inserted or implanted in a child as young as a newborn baby?
Usually, we don't do it in newborns. Usually, we do it when the baby is around a bit bigger. If we need it, usually 2 weeks and above. And what we
Mm.
can do is we can usually put in a stent to maintain the patency of the ductus arteriosus when needed in a baby with a blue heart defect, which is dependent upon blood supply to the lungs. All right, that is one procedure. Okay,
Mm.
when the baby also the baby has got narrowing of a blood vessel known as pulmonary stenosis or aortic
Okay.
stenosis, that requires early intervention, usually as early sometimes as 1 week or 2 weeks, whereby a
Mm.
balloon can be inserted to blow up the pulmonary or the aortic valve. That means the valve which is of the blood vessel going to the lungs or the left side of the heart. So these are the early procedures done. There is another procedure which can be done for babies who have got a blue heart defect known as transposition of the great arteries, whereby we
Okay.
put the balloon and we blow open the defect between both sides of the heart to ensure that there is good circulation or mixing between the right and the left side of the heart. So these are the procedures done usually in the first 1 week or 2 weeks or 3 weeks. For the
Yeah.
older children, what we do is we can put in devices known as the patent ductus arteriosus PDA occluder. Okay, and plexor ductal occluder to occlude the PDA, which is a persistent bridge between the blood vessel going to the lung
Yeah.
and the whole body. Or we can put in devices such as a VSD occluder to close
Yes.
the holes in the lower part of the septum or the upper part of the septum. But this again is in older children and it is according to the recommended weights.
Okay. Older children below 12 years old? I mean, in
Yes,
pediatric.
yes,
I see. Okay. Well, that's something that's very surprising because usually when you talk about stents and all that and the balloons and all that, it would actually people would never envision that this could be something that would warrant a baby to go through.
yes.
So yeah,
Now this is an
very
advantage.
very
This is of,
distressing for
yeah,
parents.
this is of advantage to the parents as the child can bypass surgery. So bypassing surgery is a big plus point as surgery comes with its own complications and takes a longer time for recovery.
Yes, yes, that's true. How do you counsel the? I know. I mean, this could be a little out of topic, lah, but I'm just also trying to imagine what parents will go through whenever they find out that their child has got to. It sounds very invasive.
Yes. Well, I
Yeah.
always draw and explain to them what the defect is, make them
Mm.
understand the cause of the defect. Is it related to the pregnancy or it is not related to the pregnancy? And what we
Okay.
can do. I think finding the solution for the heart problem is more important for the parents because
Yes.
they want to know whether their child can recover and can lead a normal life. If the child can recover and lead a normal life with intervention or with surgery, they should be given the best opportunity and the best option to do it. Well, if it's a heart defect that cannot be operated, or it's a heart defect that may deteriorate with time, then
Yeah.
it's just good to be honest to the parents and tell them that, it cannot be operated, and maybe the child will just require medications or may deteriorate with time.
I see. I see. Would there be? You mentioned just now that of course there are good chances. Sorry. Let me just rephrase the question because there's a lot of information actually to take on. All right. So for children who have just been treated or have just had surgery, what are, if not percentage, but what would be, in your opinion, the majority of the cases, would they be able to lead a normal life so they can play sports, and go to school just like any other child, or would they have to be, would they have to adjust their lifestyles
Well, it
because
depends
of
upon,
the
it
condition?
depends upon the heart disease which has been operated. If the heart disease is quite straightforward, or it's just, then the child should be able to lead a normal life, usually 2 months after recovering from the surgery. But if it's a complex heart surgery with some residual defect, then the child will need to have exercise restriction, and the child may have to go for more stringent follow-ups and maybe on medications.
I see it. Okay, doctor. We spoke about treatment options, which
Yes.
that was quite extensive. So, okay, children with heart problems participate in sporting activities. Just going through my notes because, I think perhaps you can explain to us about, in adulthood, if they are during childhood and they
Yes.
have heart problems, and if all works out well, and but they still have to go through treatments and whatnot. But would this be something that will follow them through adulthood, or at some point during their childhood, or maybe during adolescence, they can actually it can actually heal completely?
Okay, it depends upon the heart defect. If it's simple and it can
Mm.
be operated, or we can do an intervention for it, or if the defect
Yeah.
closes on its own, then they can
Okay.
live a normal life in adulthood. But some heart
Okay.
defects which are a bit more complex or complicated, they may have residual defects and we may need to follow them up until adulthood. So they
I
may
see.
have restriction of activities and even may have restriction in getting pregnant for ladies.
Oh, I see. Okay.
Yes.
That's news. What are the do's and don'ts of a CHD child patient for parents to?
Okay, the
I
do's
don't,
and
I don't need to look so happy while asking that, but I just want.
Okay, I think it is important for the parents to take them to a pediatric cardiologist to get the heart problem assessed, to
Yeah.
follow the instructions, to take medications if necessary, to go for the regular follow-ups. If there's exercise restriction, yes, they should have exercise restriction. If it is amenable to intervention or surgery, then the parents should not delay that. All right,
Okay.
and those are the do's, the don'ts for it. Yes, and
Okay.
regarding this, what's
Yeah.
important in female children is
Mm-hmm.
sometimes if the congenital heart disease is detected late or is complex, then they are advised not to get pregnant after marriage, and they are advised to have to be careful with their condition. So these ladies require maybe some joint care with the gynecologist and obstetrician to help them in after the marriage, and they may require counseling for their marriage together with the psychologist as they advise not to get pregnant. So that's a tricky
Yeah.
matter too. Yes.
Okay. Let's talk about children at the school-going age because there's just a lot of activities going on in school, especially sports. What's the worst that can happen, apart from the obvious, that can happen to a child, should there be not much care that goes into the bringing
Okay.
up of the child, as a child heart patient?
Okay, a child with a complex heart disease or a child which requires exercise restriction who is not well taken care of may exert him or herself in school and may just faint or have sudden death. So that is the backside of it.
I see. Okay, doctor. Well, we do have some questions from our audience. And a lot of people are saying hi to you. We've got Barjish, Paul, Cecilia, Daniel. So everyone's excited that you are actually here live. Okay,
Thank you.
children with heart problems participating in sporting activities like other children. Oh, okay. This is from Mr. Haziq Nadira.
Yes. Well, children with heart problems can participate in sporting activities as long as the pressure in the blood vessels are within an acceptable limit. For example, if the pressure in the blood vessels are exceeding an acceptable limit, then they advise not to participate in exert sports which exert, where they can exert themselves a lot, or contact sports. So they are
Okay.
advised to do simple sports. For example, they can play golf, okay, or they can just participate in very light sports, for example table tennis, which is not exerting them much.
Doctor, on that note, would the heart rate of the child heart patient, would they be any
Yes.
different from a child at that age, a normal child?
Yes, it can happen. For example, if the child is in heart failure, meaning that the heart is enlarged and there is excessive blood flow going to the lungs, then the heart rate
Yeah.
can be faster than normal. In some complex congenital heart conditions, the heart rate
Yeah.
can be slower than normal, and it's a condition known as heart block.
I see.
Yes.
Okay. Let's take this question from Ms. Nabila Rahim. Can heart problems develop after the child is born?
Yes, heart problems can develop after the child is born, but then and again, it's not congenital, it's acquired. Acquired means either due to infection, all right, or due to some other disease process.
Okay, all right. Hope that answers your question, Ms. Nabila Rahim. Okay, Haziq Nadira. Sorry, just now I said Mr. Haziq Nadira, actually. Then I see a picture of a woman. Okay, there's also another question that she posed here. Hi, doctor. What are the causes of stage D? Maybe you can just briefly repeat what you mentioned in the earlier part of the show.
Yes, congenital heart disease can be detected before birth, that is in utero, as early as 14 weeks of pregnancy. But the detection requires an obstetrician who is trained in detailed scan and subsequently referred to a pediatric cardiologist who is also trained in doing fetal echocardiograms. So this requires a high skill, but it is possible.
Okay. One last question from Mr. Bajish Paul. Hi, can CHD be diagnosed before birth?
Yes, I think I just answered that question.
Ah, okay. All right. Okay, doctor, I think that's all the questions that we have from our audience. But since we still have more time, maybe you and I can banter a little bit more lah about this. We are talking now, for those of you who have just joined us, we're talking about congenital heart diseases in children because apparently, yes, children also suffer from heart diseases. And there are quite a few conditions, yeah, according to Dr. Jasvinder Kaur, who is a pediatrician and also pediatric cardiologist at Columbia Asia Hospital, Setapak. Sorry, I seem to be having a bit of a cough. Okay, but yes, social distancing, this is definitely as far as we can get since we are on live streaming right now. Okay, about childhood heart diseases, would you say that it's worrying right now in Malaysia?
Well, it is not worrying, but the awareness has increased and the detection rates have increased due to the awareness and due to the
Yeah.
increasing number of pediatricians who can do echocardiograms, and also the pediatric cardiology and the cardiothoracic services in Malaysia. It has improved over the last many years. So the
I see.
detection rate is earlier, and hence the treatment is earlier and the outcome is better.
I see. Okay, that's good to know. It sounds like quite a lot of sophisticated machines going on there.
Yes.
I see. And okay, for the baby, the infant, how I'm just trying to imagine a scenario where the baby is actually a heart patient, and then there would be a lot of things that's going on with the child. I'm just imagining maybe like cables and wires and whatnot. But isn't this like traumatic for both baby and parents? And how would you handle a situation like that?
Well, I think it is not so traumatic for the baby, except that if the baby undergoes heart surgery, yes, the baby will be in pain. But then and again, the baby is covered with good analgesia or pain relief. For the parents, it is traumatic because they are seeing their child undergoing tests and being
Yeah.
detected with heart disease, undergoing intervention and operation. It is not easy. So sometimes
Yes,
it
of course.
needs repeated counseling sessions, involvement of a psychologist, involvement of the nurse, showing them the operating room, showing them the cardiac catheterization lab, repeatedly
Right.
drawing, repeatedly drawing and explain about the heart diseases. So it takes many sessions sometimes to get them through a child who is having a complex congenital heart disease. But at the end, they understand that we are doing it because we want to improve the outcome of the
Yeah,
child, and we want the
that's
child
right.
to grow like any other child.
That's right, doctor. Anything that the mother can do in order to avoid something like this developing in her baby, and maybe certain behaviors during pregnancy.
Yes, avoidance of alcohol, avoidance of smoking is very important, and
Mm-hmm.
also maintenance of a good blood sugar level for those
Mm.
mothers who have got diabetes during
Yeah.
pregnancy. That's very important. And even mothers who have diabetes before conception or before pregnancy, their blood sugar
Mm.
levels must be in good control because it is well known that infants of diabetic mothers or babies
Mm-hmm.
born of diabetic mothers are at risk of developing certain congenital heart diseases, even as high as 10% risk of congenital heart disease. And these
Right.
congenital heart diseases can be either holes or can be a thickened heart or transposition of blood vessels, which is the blue baby heart defects.
Okay. For mothers who themselves were child heart patients, when they
Yes,
gave birth, would their children have a risk as well of
yes,
having problems with?
yes. There is around a 3 to 18% risk of their child developing congenital heart disease. So
Okay,
they
so
will,
directly
yeah,
from the mother.
yes, so they will be screened early. A detailed scan will be done early during pregnancy to see whether this fetus, developing fetus, has any heart problem or not.
I see. But when we're talking about it being a hereditary issue, then would
Yeah.
it, or let's say if the grandmother, how far away from the family tree would a heart patient has to be in order for the child to not have a heart condition?
Well, there
Is it
are
the mother or?
no, there is no certain generation involved. As long as there's one side of the family or both sides of the family, there is a congenital heart disease, the child is at risk. But we do not
Okay.
have the statistics whether if the grandmother, the maternal or the paternal grandmother or grandfather has congenital heart disease, what the risk would be for the baby. We only have statistics when the mother has congenital heart disease or if the siblings have congenital heart disease. Then we have
Oh,
the statistics for the developing fetus and the newborn.
I see. Okay. Okay, doctor, I don't have any more questions to ask actually, but it has been a very interesting topic and a lot has been unfolded. So thank you very much again to Dr.
Thank you.
Jasvinder Kaur, who is our consultant pediatrician and pediatric cardiologist at Columbia Asia Hospital, Setapak. Good afternoon and thank you again. Have a good day. Thank you, doctor. Bye. Thank you,
Bye.
everyone.